Hey everybody, it's Dr. Alan Bauman from Bauman Medical Hair Transplant and Hair Loss Treatment Center. And you know, today's hair transplants can be 100% undetectable. But if you've had a procedure years ago, it might need a little touch-up, refinement, or repair. And this takes artistry, technology, and expertise. That's what we've got at Bauman Medical. So here's Dr. Vogel to tell you a little bit more.
Hi, I'm Dr. James Vogel, Dr. Bauman's associate here at Bauman Medical in Boca Raton, Florida. Do you or anyone you know have a hair transplant that does not look completely natural, or perhaps have some visible scars in the hair transplant donor area? I've spent the last 30 years of my plastic surgery career and career in hair transplant surgery helping people to obtain a natural hair transplant after they've had a previous transplant that did not look completely natural. For example, a hair transplant can appear unnatural for many different reasons. First, they can be performed using techniques that are not state-of-the-art. Another reason is that transplants can be performed using older techniques where large clumps of hair were used instead of individual grafts. This results in a very pluggy appearance. As seen in this example, hair transplants can look unnatural and pluggy when older transplant techniques have been used, such as in this patient who underwent correction and softening of transplant plugs from over 20 years ago. The majority of men that have hair transplants that do not appear natural are very uncomfortable with their appearance. Fortunately today, we have many different techniques that are suitable for addressing these problems. At Bauman Medical, some of the state-of-the-art techniques we use rely on modern instrumentation, state-of-the-art techniques and concepts, as well as non-surgical options to help you restore that normal appearance. These techniques include, but are not limited to, softening the pluggy appearance of the hairline, adding hair to areas where the hair has receded beyond the hair transplant, sometimes adding micropigmentation in terms of a tattoo to an area that's exposed, and also adding hair to exposed donor scars in the hair transplant donor area to camouflage those regions. And we also use a multitude of regenerative, non-surgical medical techniques to augment all of those procedures. Because these techniques for repairing hair transplants require some special dedication of instrumentation and techniques, we are dedicating 2 separate weeks this summer to perform repair hair transplants for patients that need it. So, if you or anyone you know could benefit from a repair hair transplant to soften the appearance of your previous hair transplant, call or click below. I look forward to meeting you, and thank you very much.
So if you're ready for a hair transplant repair or touch-up, and you'd like to talk to Dr. Vogel about this, click the links below, and we'll get your journey continued.